CDC says a far more contagious variant of the coronavirus, first identified in the United Kingdom, is now the dominant strain in the United States. Florida and Michigan have the highest number of cases of the variant, and those are two of the 5 states that now account for about 43% of all cases. What's more, Michigan is now in the throes of a surge in cases. Another reason our next guest says that despite the success with vaccinations thus far, it's premature to declare victory. We're pleased to welcome Dr. Anthony Fauci, President Biden's chief medical advisor. Thanks for being with us, Dr. Fauci. CDC Director Dr. Rochelle Walensky is warning of clusters of cases associated with daycare centers and youth sports. Yesterday, you warned that more and more young people are getting into, quote, serious trouble, namely severe disease requiring hospitalization. Why are cases among kids and young adults now suddenly rising?
You know, I think it's what's called, the relative impact of the virus. We're seeing now among elderly individuals, which were really those that were the most vulnerable some months ago. But right now, for example, more than 75% of individuals 65 years of age or older have had at least one shot of a 2-shot vaccine, which means when you look at the entire population, there's relatively more protection among older individuals as opposed to younger individuals. So what we're seeing now is what appears to be, but it's actually the reality of a disproportionately more infections in younger individuals. You combine that with what you just mentioned, what Dr. Walensky said about clusters of cases in daycare, as well as school sports, particularly team sports, which people engage in close contact without masks. I think that is what is explaining these surges of cases in young individuals, driven by the variant that you mentioned, the B.1.1.7, which had originated in the UK and now is dominant in the United States.
The Pfizer vaccine, it's available for teenagers 16 and up. Moderna, Johnson & Johnson vaccines are available for people 18 and up. What do you recommend parents of children under the age of 15 do, since there's no vaccine available to them? I mean, is it safe for children to be around unmasked, vaccinated people?
Yeah. Anderson, I think what we have to do is to abide by the public health measures that we recommend to the extent that we possibly can. That is universal masking, avoiding close contact, avoiding congregate settings, particularly indoor. There are a number of tests that are going on right now, trials in age de-escalation to be able to vaccinate children at a younger and younger age. There was just a trial that was completed that showed essentially 100% efficacy in preventing COVID-19 in kids 12 years old to 15 years old. And soon we're doing studies that hopefully within a period of several months will get similar results in younger kids, even down to the age of 6 months.
So just nationwide, kind of big picture, in terms of hospitalizations, in terms of deaths, where are we in this pandemic? I mean, in terms of the highs we've seen and the lows we've seen.
Well, certainly deaths are coming down. Hospitalizations are coming down. We're seeing hospitalizations, as you alluded to a moment ago, a bit more skewed to younger people than it were several months ago. But the number that is disturbing, Anderson, is the number of cases each day. When we had the big spike that we've discussed so many times that went way up to, 2 to 3 or more 100,000 cases per day, then it came back down. But now it's plateaued at a disturbingly high level. The last count yesterday was 63,000 cases in a single day. When you're at that level, there is the risk of getting a surge back up. So the way we're looking at it now, it's almost a race between getting people vaccinating and this surge that seems to want to increase and do what's going on, for example, in Europe, where they're having some surges now that are really quite alarming. We're vaccinating now between 3 and 4 million people per day, and the vaccination program is going on really very well. So if we could just, as I've said so many times, hang in there a bit longer to get each day more and more people by the millions are getting vaccinated to the point where we'll have enough people vaccinated where the risk of that surge will diminish greatly. So that's really where we are right now, this kind of balance of a risk benefit, namely getting the vaccines going and not just pulling back on all the public health measures. Now's not the time, as I've said so many times, to declare victory prematurely. We still have a considerable risk there that we need to get by.
So what is it known or clear what percentage of the population needs to be vaccinated or fully vaccinated in order to kind of cross that threshold?
You know, Anderson, the honest answer is no. It's going to be a combination of people who are vaccinated and those who have been infected and have successfully recovered and are immune to reinfection, at least with the wild type virus that infected them in the first place. This is a very elusive number, this issue of herd immunity. It varies from disease to disease. It varies on the ability and the efficiency of transmission from person to person. And it varies with the efficacy of the vaccine. I've said multiple times that my estimate, and I have to underscore, Anderson, it's only an estimate, that it's somewhere between 70 and 85% of the population where you have a combination of people who are vaccinated and people who've recovered. You don't need necessarily to get to this mystical number. The more and more people you get vaccinated, the closer and closer you get to control. So you may get to 50% of the people vaccinated or 60% and still get to the point where you have a marked diminishing of the number of infections per day. That's what we're looking for. And I believe we're going to get there if we keep vaccinating people at the rate that we're doing right now.
There is still confusion about what vaccinated people can and cannot do. Obviously, you try to model best practices in your own life. You've been vaccinated. You're still wearing masks, double masks, I believe. I know you said you would feel comfortable flying right now if it was essential. Do you go out to dinner? Have you seen your, daughters yet? I mean, what do you tell people who've been vaccinated and, are not necessarily, wanting to be models for everybody else, but don't want to do anything to hurt other people?
Anderson, there's kind of a twofold answer to that. What you can do now and what's going to happen literally as the weeks go by, because the more people outside besides yourself that are vaccinated, the more you can do as a vaccinated person. For example, the first guideline that the CDC put out answering your question is, what can you do if you're vaccinated? And that is, if you're with another vaccinated person in the setting of a home, you can really act normally. You don't need a mask. You can have physical contact, even if there are people in that home setting who are not vaccinated. Because if they are healthy people and the risk of their getting a really serious impact or a serious effect of infection is so low, you can interact with them without a mask. The next thing that was mentioned was travel. Even though travel does increase the risk of transmission, if you're going to need to travel, being vaccinated diminishes the risk considerably, and there are certain things that you don't necessarily have to do. You don't have to get tested before and after you travel, except if the destination requires that. When you come back from international travel, you don't have to quarantine yourself. And what we're going to be seeing more and more, Anderson, is that guidelines are going to come out about acting out in the community, going to restaurants, going to places of worship. Again, your own protection because you're vaccinated. The more people around you vaccinated, the more leeway and flexibility you're going to have.
Dr. Anthony Fauci, I appreciate your time. Thank you.
Good to be with you. Thank you.